Hello, good day. So, our case study is pregnancy-induced hypertension. And the presenters or this presentation is presented by Mr. Bico, Mr. Dela Torre, Mr. Mariano, Mr. Mina, and the one speaking right now is Mr. Sepulveda. So, let's continue. Our presentation outline, we would start with our introduction, our objective, and our overview. Then we would continue with the anatomy and physiology of PIH. Next is the pathophysiology. Next is our NCP or our nursing care plan. So let's start with our objective with our presentation. Again, our presentation is PIH or pregnancy-induced hypertension. So let's start with our objectives. By the end of this presentation, the students will be able to explain the nature and background of pregnancy-induced hypertension and its associated risk factors. Next is determine the affected body system and its anatomy and physiology. Next is enumerate potential complications related to pregnancy-induced hypertension or PIH. And our last objective will be develop comprehensive and detailed nursing care plan and nursing management that is applicable to a patient diagnosed with pregnancy-induced hypertension. So that would be our objective, and I hope that we can follow along and meet our objectives for this presentation. Our overview of pregnancy-induced hypertension or PIH. So pregnancy-induced hypertension is a form of high blood pressure in pregnancy. Pregnancy-induced hypertension is also called toxemia or preeclampsia. It occurs most often in young women with a first pregnancy. So it is more common or happens often to younger women who are having their first pregnancy. And it is more common in twin pregnancies and in women who had PIH in previous pregnancy. So if a mother is already multigravidarum and has experienced PIH before, she can also get PIH in the next pregnancies. Next is with high blood pressure, there is an increase in the resistance of blood vessels. This may hinder blood flow in many different organ systems in the expectant mother, including the liver, kidney, brain, uterus, and placenta. So let's repeat so we can remember the liver, kidneys, brain, uterus, and placenta. Next is there are other problems that may develop as a result of PIH. Placenta abruption or premature detachment of the placenta from the uterus. This may occur in some pregnancies. PIH can also lead to fetal problems including intrauterine growth restriction or poor fetal growth and stillbirth. Next, if PIH is untreated, severe PIH may cause dangerous seizures and even death in the mother and fetus. Because of this risk, it may be necessary for the baby to be delivered early before 37 weeks gestation. So the statistics about PIH or pregnancy-induced hypertension is the incidence of hypertensive disorders of pregnancy increased from 16.30 million to 18.8 million globally, with a total increase of 10.92% from 1990 to 2019 or 2019. So it increased 10.92%. Hypertensive disorders of pregnancy account for 36.7% of all maternal deaths in the Philippines, which is much higher than the worldwide rate of 18%. So, I would pass it to the next reporter for his part. And thank you for listening.
Now, let's talk about the anatomy and physiology of PIH. You see, during pregnancy, the blood flows to several organs, which increases to satisfy the increased metabolic needs of tissues. As a result, the venous returns and the cardiac output both increase considerably. Um, During the first 2 trimesters, the cardiac output steadily increases, with the highest increase occurring by 16th week of pregnancy. By the 5th week of pregnancy, the rise um, of cardiac output is well established, and by the 16th to 20th weeks of pregnancy, it has increased to 50% above pre-pregnancy values. After 20 weeks of pregnancy, the increase in cardiac output usually stay in that certain level and remains elevated until the baby is born. A significant increase in stroke volume and heart rate are associated with increase in cardiac output. Now, let's talk about the PIH. You see, the PIH or preeclampsia is caused by the placenta, and the only known remedy for it is that to is the delivery of the placenta. Its symptoms are thought to be secondary to organ hypoperfusion, which is caused by vasoconstriction, intravascular coagulation, and a decrease in maternal blood volume. Preeclampsia is a multi-system pregnancy condition caused by a hereditary predisposition. It affects maternal renal, cerebral, hepatic, and clotting systems, as well as increasing blood pressure, and is more common in first pregnancies. Placental insufficiency caused by abnormal placentation or failure of adequate trophoblast invasion of maternal vasculature, and possibly abnormal autocoid production, which affects the fetus. Now, let's talk about the pathophysiology of PIH. First thing here is what would happen here is vasospasm, or the narrowing of the arteries because of the contraction of the blood vessels. And then there are 3 things that would happen when a pregnant woman had vasospasms. Those are increased blood pressure, a decrease of circulating volume, increase of extravascular fluid, organ perfusion, and vascular damage. Then after that, there are 5 parts that would be affected because of these 3 things. Let's start with placenta. If there's some kind of trauma on the placenta, it might cause abruptio, since the cause of placental abruptio is not often known, which would lead to fetal distress or much worse, fetal death. Next one is the cerebrum. The patient might have edema or ischemia, a condition in which the blood flow which restrict or reduce in a part of the body. Ischemia, which would lead to headache, no, or much worse, a seizure or coma, which also affect the placenta and also cause a intracranial hemorrhage, which would lead to maternal death too, and fetal death. Next one is retinal. For this part, the patient might get a edema or visual disturbance, which would lead to retinal detachment. And then the patient might get disease in their kidney like oliguria, proteinuria, or sodium retention, which is a major pathophysiological mechanism of hypertension development in chronic renal diseases, which would lead to plasma problem and peripheral edema to maternal death. It can also cause renal tubular necrosis, which would lead to acute renal failure, then maternal death. And lastly is liver. The patient might develop periportal um, hemorrhagic necrosis, which is a necrosis of hepatocytes localized around the portal vein. The hepatocytes plays important roles in metabolism, detoxification, protein synthesis. That's why after the necrosis of hepatocytes, the patient might develop um, subcapsular hematoma, which is the accumulation of blood in the liver caused by blunt trauma or other predisposing condition, which would lead to liver rupture and then maternal death. Next part will be our nursing care plan.
Good day, I'm Shawn and Mina, and today I'll be discussing our problem 1 entitled Increased Blood Pressure. So for our subjective cues, we have here as quoted, para lagi akong nahihilo, lagi din pong masakit ang ulo. For our objective cues, there are shortness of breath, increased heart rate, blood pressure above 140/90 millimeter mercury, and dizziness, headache, nausea, and vomiting. For our nursing diagnosis, is a decreased cardiac output related to vasospasm as manifested by increased blood pressure. So the reason for having this nursing diagnosis is because a decreased cardiac output means that the output is lower than 4 liters per minute. No? So this has 4 factors such as how fast the heart beats, which is the heart rate, how much the heart muscle contracts, how much the ventricle stretches when the heart muscle relaxes, and allow the chamber to fill with blood, and the force where the ventricles must act against the pump blood, so throughout the body. And for our plan for nursing outcome classification, there is a circulation. We have here a circulation status. No, for our long-term goal, after 2 to 4 weeks, a patient would have adequate cardiac output as shown by normal blood pressure, pulse rate, and rhythm. No, and strong peripheral pulses and ability to tolerate activities without symptoms of dyspnea, syncope, or chest discomfort. No? Dyspnea is difficulty of breathing, and the syncope is fainting or passing out. No? For our short-term goal, this goal must be met within the nurse's shift. No? After 8 hours of nursing intervention, the patient won't manifest any increased blood pressure. So for our intervention, in a nursing intervention classification, hemodynamic regulation, independent intervention, assess the vital signs, conduct physical examination, and start daily weight monitoring. The reason for doing this is because the patient's elevated blood pressure is linked to edema, headache, vision abnormalities, and epigastric pain. So a common signs of pregnancy-induced hypertension is a weight gain. And that's why we must measure a daily weight monitoring. We must do daily weight monitoring. If the woman gains more than 1.5 kilogram per month in the second trimester or more than 0.5 kilogram per week in the third trimester, the patient is likely to have fluid retention. Our second independent intervention is track the patient to have a complete bed rest and avoid environmental stressors. No? To lower the patient's blood pressure, maintain heart rate, and improve renal placental perfusion. No? For environmental stressors, we avoid annoyance around the patient. No, we don't want a mother to be angry. No, because stress increase blood pressure, so combined with hypertension, no, so it is dangerous to the patient. So prepare to deliver the baby either by labor induction or cesarean section. No. After 6 weeks postpartum, PIH normally goes away. If the risk to the woman and the fetus increases, the baby may be delivered earlier than the estimated date of delivery, EDD. For our dependent intervention, administer hypertensives as prescribed, such as angiotensin converting enzyme inhibitor, calcium channel blocker, diuretics, and beta blockers. ACE inhibitors and angiotensin 2 receptor blockers get blood vessels from narrowing as much. Calcium channel blockers prevent calcium from entering the muscle cells of the heart and blood vessels. So this allows the uh, blood vessels to relax and dilate it. And diuretics remove extra water and sodium from the body. So this lowers the amount of fluid in the blood. This often used with other blood pressure medications and sometimes in one combined pill. And beta blockers help the heart beat slower and with less force. This means that the heart pumps less blood through the blood vessels. This is typically used only as a backup option or if also have certain other conditions such as heart disease. If the mother has heart disease. So for our collaborative intervention, we collaborate with the dietitian about dietary restriction for healthy lifestyle changes, which can help reduce the high blood pressure by managing stress, reducing sodium intake in the diet, and getting enough sleep. So we also collaborated with a surgeon about cesarean delivery. So women with hypertension are more likely to have a C-section than women with uh, normal blood pressure. No? So high blood pressure can be dangerous for mother and fetus. While many women with high blood pressure deliver healthy babies, hypertension can affect the mother's kidney and increase her risk of heart disease, kidney disease, and stroke. So for our evaluation, so if it is goal met if after 2 to 4 weeks the patient had adequate cardiac output as shown by a normal blood pressure, pulse rate, and rhythm. No? Also strong peripheral pulses, radial pulses, and popliteal and dorsalis pedis pulse. No? So there is a strong peripheral pulse in that area. And the ability to tolerate activities without symptoms of dyspnea, syncope, or chest pain. Also, goal met within the nurse shift after 8 hours of nursing intervention. The patient didn't manifest any increased blood pressure. So normal blood pressure throughout the nurse's shift. So thank you for watching. This is our problem 1.
So, good day or good morning. So, this is my problem number 2. So, complete bed rest without bathroom privileges. So, the cues are for the subjective. The patient may report feelings of boredom. So, I feel bored. I wish there was something that I can do, or she could not do usual hobbies and cannot be undertaken in the current setting. So uh, this can be like, can I still do this like I did before? So this would be verbalized by the patient. So for the objective cues, flat affect, disinterest, inattentiveness, restlessness or crying, as well as lethargy or withdrawal, and can even be hostility towards the nurses or loved ones, and overeating or lack of interest in eating, weight loss or weight gain. So next, for the nursing diagnosis statement, the nursing diagnosis is deficient diversional activity related to isolation and inability to engage in usual activities secondary to prolonged bed rest or hospitalization. So for the rationale, this nursing diagnosis is related to complete bed rest without bathroom privileges. So patient with pregnancy-induced hypertensions have limitations to their movements and may stay in long durations in the hospital. Thus, the patients are dealing of boredom and can be depression. So for the planning, so the nursing outcomes classification, so leisure participation. So for the goals, the long term goal would be, after 1 week of nursing interventions, the patient will recognize own response and initiate appropriate coping actions, engage in satisfying activities within their personal limitations. So next, for the short-term goal, within 4 hours of nursing intervention, the patient will engage in diversional activities and relates the absence of boredom. So for the interventions, the nursing interventions classifications would be recreational or recreation or activity therapy. So first, for the independent nursing interventions. So first is determine a vocation and hobbies clients previously pursued. So if you can incorporate these activities, if appropriate, into present program. So if she was uh, fond of reading books before, this can also be applied to the program. So encourage involvement. So for the rationale, encourages involvement and helps to stimulate the clients mentally and physically to improve overall condition and sense of well-being. So next, intervention, encourage participation in mix of activities and stimuli, such as music, educational presentations, crafts, and social interactions as appropriate. So offering the different activities helps the client to try out new ideas and develop new interests. So activities need to be personally meaningful for the client to derive the most enjoyment from them, such as talking or braille books from the blind and closed caption TV broadcast for the deaf or hearing impaired. So next is plan to spend quality time with the client for roughly about 1 hour each day, or can be exceeded by that. So for the rationale, it validates the client's concerns and worth as a person. And next, intervention is explain the rationales for the limitations to the client and significant others. So the rationale for this is understanding the rationale for limits improves compliance and the cooperation between the patient or client and the nurses. So the more they understand, the more they can cooperate and understand the meaning behind these actions that or interventions that we are doing. So next is assess for evidence of the patient desiring something to read or do, daytime napping, and express inability to perform usual habits or hospitalizations. So these are indicators of boredom. Next is personalize the patient's environment with favorite objects and photographs of significant others. So this can also be if the client is fond of painting, the clients can buy paintings or uh, bring the paintings to their hospital rooms. So to personalize and soothe and calm the patient. So the rationale for this is this intervention provides visual stimulation. So last for the independent interventions, provide change of scenery when possible, alter personal environment, and encourage trips to shops or participate in local and family events. So stimulates energy and provides new outlook for client if the client can do so. Next is collaborative, refer to occupational therapist or activity director. So the rationale is uh, can introduce and design new programs to provide positive stimuli for the client. So for the evaluation, so again for the long term, after 1 week, the patient recognize their own response and initiate appropriate coping actions, such as personalizing their own rooms with significant others, and engaging in satisfying activities like puzzles and board games within personal reputations. And for the short-term goal, after 24 hours or 4 hours of intervention, the patient engage in diversional activities such as reading books, watching television programs, and speaking to significant others and nurses, and relates the absence of boredom. So that is it for our NCP for the second problem. Now we move on to the third problem.
So now let's proceed to the third problem, our problem number 3, which is convulsion. So first, let's define what is convulsion. So convulsion, it is an episode in which you experience rigidity and uncontrolled muscle spasms along with altered consciousness. So now that is done, let's now proceed to the subjective and objective cues. So next slide is for the subjective cues, as stated by the patient, quote and unquote. A quote is that naninigas po ang aking katawan, and unquote. And another one is, quote, di po ako makahinga ng maayos, and unquote. This states that for the objective cues is that it causes the stiffening of the arms, legs, or whole body of the patient, and also changes to breathing. And as I have stated a while ago, stiffening of the arms, legs, and or whole body, which then leads to lack of control over movement, so that the patient does not have the full access of moving the joints or the body as well. And then for the nursing diagnosis, the statement is this is risk for maternal and fetal injury related to tonic-clonic convulsion. So tonic and clonic convulsion are two different types of seizures, which will be then further discussed onto the rationale. So for the rationale, accentuated risk of injury with the individual's adaptive and defensive reserves. So tonic seizures were the related factors of stiffening of the muscles, and clonic seizures that are characterized by jerking or twitching that can lead to risk for maternal and fetal injury. So next is for the nursing care plan. So for the nursing outcome care, it will be divided into two, which is the symptom control and fetal and maternal status. So for the goal, for our long-term goal is that after a week, the client applies and maintains symptom control to prevent such experiences of any convulsions that can affect the mother and fetus health. And then next is that for our short-term goal is that after 2 hours or within 2 hours, the client and fetus will not experience injury from convulsions. Okay, next is for our intervention. So we'll start first onto the independent intervention. So for our nursing intervention care is that first we should is that assess for signs of worsening condition such as headache, nausea, vomiting, visual, and or epigastric pain. So for the rationale for this is that this assessment provides information, an increased oral nutritional supplement, in irritability, and portal hypertension. Thus leading to ominous signs indicating imminent convulsions. So next one is provide decreased sensory stimulation, such as dim lights, to provide a quiet atmosphere and to limit visitors to significant under. So the purpose of this is that the rationale for this is that interventions decrease cerebral stimulation, and significant other may provide reassurance and comfort. Next is to the intervention for our dependent intervention is that to administer antihypertensive medications as ordered and per protocol, if ordered by the physician or doctor. So the rationale for this is that magnesium sulfate is a CNS or central nervous system depressant that decreases acetylcholine release at motor neurons that prevents convulsions. So for our next nursing intervention is that for the collaborative is that refer to the physician if the urine output reaches 30 cc per hour. So the rationale for this is that the kidneys excrete magnesium sulfate intervention, which prevents toxic accumulation. And then now for our evaluation to meet our goal. So goal met if after a week, client applied and maintained symptom control to prevent such experience of any convulsions that can affect the mother and fetus. And lastly is the goal met for the first goal that I have stated is the long-term goal, and then the next goal is the short-term goal, which is after 2 hours or within 2 hours, client and fetus will not experience injury from convulsions. So this is our source of information or references for our PowerPoint and for our research and about pregnancy-induced hypertension. So yan, and that is the end of our presentation, and thank you for listening and watching, and I hope you have learned a thing or two, and that is all.